Now let's discuss the Horner syndrome. Horner syndrome, it is characterized by the ipsilateral. Ipsilateral means inside. So ipsilateral ptosis, meiosis, and anhidrosis. That is, this patient is, let's suppose this is the right side of the patient and this is the left side of the patient. So this patient is having ptosis, meiosis, and anhidrosis on the right side of this patient, and the lesion will be on the right side. Okay, so that's why this is called ipsilateral ptosis, meiosis, and anhidrosis. Horner syndrome is characterized by these. Now, what happens that this Horner syndrome occurs? So there is problem in the first neuron or in the central neurons or in the second neuron or preganglionic neurons or in third neuron or postganglionic neurons. So in first neuron or central neurons, if there is a lesion in the hypothalamus or if there is a lesion in this blue one, first neuron, so it will cause Horner syndrome, and this Horner syndrome will be because of the central origin. And what are the common reasons that may occur in this first neuron or central Horner syndrome? So the first thing is lesion in this hypothalamus. If there is lesion in the hypothalamus, it may cause the Horner syndrome. The second thing is if there is lesion in this first neuron. So what are the possibilities? The one possibility is brainstem stroke. So if there is a stroke in this brainstem, so it may affect this first neuron or the central neurons, and it may cause Horner syndrome. The second thing is if there is injury in this cervical region. So if there is injury in the cervical region, it may cause a Horner syndrome. If there is some anatomical malformation, so this may affect the first neuron and may cause the Horner syndrome. And the next thing is demyelinating disease. So if there is demyelinating disease, so it may also cause the Horner syndrome. So these were the causes of the central or the first neuronal Horner syndrome. Now let's coming towards the second neuron or the free ganglionic. Why they are called free ganglionic? Because these fibers, the green one, these are the green fibers, they are coming to this ganglia, and this ganglia is called superior cervical ganglia. As these fibers are before the ganglia, that's why they are called free ganglionic fibers. Now, what are the possibilities that may cause the lesion of these preganglionic fibers and may cause the Horner syndrome? So this may be Pancoast tumor, that is tumor of the apex of the lung. So if there is a tumor of the apex of the lung, that is called a Pancoast tumor, may cause the preganglionic Horner syndrome. The second thing is if there is trauma in this region, so that may also cause the preganglionic Horner syndrome. The third thing is if there is lymphadenopathy. So if the lymph nodes have some pathology, so it may compress these preganglionic fibers and may cause the Horner syndrome. The last thing is if there is lesion of the carotid artery. So if the carotid artery lesion is there, it may compress these preganglionic fibers and may cause the preganglionic or second neuron Horner syndrome. Okay, so Pancoast tumor, trauma, lymphadenopathy, and carotid artery lesion. These are the three things that may cause the preganglionic Horner syndrome. Now, next to this preganglionic or second neuron Horner syndrome is the another neuron, and that is called the postganglionic, the third one. What are the possibilities? So the possibilities is there is internal carotid artery. If there is a dissection of this internal carotid artery, so it may cause the third neuron or postganglionic Horner syndrome. The second one is if there is any tumor in the region and it may compress the third neuron or postganglionic fibers, so that may also cause the Horner syndrome. And the last one is if there is herpes infection, herpes zoster infection. So the herpes zoster infection may also cause the third neuron Horner syndrome. Why the Horner syndrome is caused? So if you look over here, this is the supply from this sympathetic chain to the sweat glands of the face. So that's why in Horner syndrome is anhidrosis. The second thing is there is supply by the third neuron of your dorsal muscle. So if this is lost, whether in the central, that is a first neuron, or in the preganglionic, that is the second neuron, or in the postganglionic, that is the third neuron, so supply to this muscle, that is the superior dorsal muscle, will lost and it will cause ptosis. So this will cause ptosis. And the third thing, it also supplies the iris dilator muscle. This is the iris dilator muscle. So if this supply is lost, so it will cause meiosis of the patient. So ptosis, meiosis, and anhidrosis, and will be on the ipsilateral side. That is, if this is the right side, so lesion will also on the right side. That's why this is called ipsilateral ptosis, meiosis, and anhidrosis. If a patient is having, we will say that the patient is having Horner syndrome, and the Horner syndrome will be because of three neuron lesions, whether it will be in the central, preganglionic, or postganglionic. First neuron, second neuron, or third neuron, and each having different causes.